For us, like many others, Miles' SIA journey began with a rash. So 2 weeks after his second COVID infection, he developed a spotted rash across his hands, face, and legs. And over the next month, doctors from our large pediatric hospital diagnosed with hand, foot, mouth, hives, eczema, even pinworms due to itching. He started to complain about his feet being sore every evening, and we soon realized he had a fever. Then he also suffered from immense joint pain to the point where he was able to walk or hold a pencil. They came like clockwork, gone in the morning, and repeated every night, never missing a day. Our pediatric hospital called him a medical mystery after urgent care visit, night in ER, and multiple follow-ups. In desperation, we emailed our old pediatrician across the state and shared all the reports we had, and she instructed us to fly Miles to another pediatric hospital, which we promptly booked a flight and was on the way in an hour. We were admitted immediately at the second pediatric ER, where they reran the labs, confirmed similar results. While the hospital, we received a call from the first hospital saying that they believed that Miles needed to be checked for Kawasaki disease, and we said that we were already inpatient. He was arthritic in his fingers, ankles, knees, with joint effusion in both knees. His ID panel was unremarkable except for the rhinovirus, and after 3 days, they finally discharged him with JIA and naproxen. And I think some of his labs are shown above for when he was diagnosed. Despite some relief in the joint pain, the fevers broke through the naproxen every night, and the rashes continued to increase. I asked about the biologics, but then the rheumatologist told us to wait longer to see that the naproxen would work, but his labs kept on increasing, and his inflammation markers continued to get worse. So we insisted again. I mean, the ferritin went past 600, which is, he's still kind of at the early phase, but it's obviously that it was increasing very rapidly. We insisted on biologics again, and then they were able to test for the HLA markers, and his HLA-DRB 115 came back negative. But despite multiple tests, the TB test kept coming back indeterminate, which delayed us a little bit further. But then we pushed forward, and then he was able to get anakinra, and his symptoms started to improve within 24 hours. After about 1.5 weeks, his labs also significantly improved. So we asked to test Miles' L18s, actually, citing the research that we had read. But my request was denied multiple times. Even in 2 different separate appointments, I insisted I could pay out of pocket. The reasons for denial included that it was just too difficult to test, as they would have to be sent to Cincinnati. The rheumatologist also suspected that his results would just be completely normal because he was not an MAS, and they would only run it if he was an MAS. But I wondered, isn't that a little bit too late? Don't we want to... The goal is hopefully to track the patient, monitor and treat the patient before they get to that point. At that point, we've been living away from home for a while, so we decided to move near a hospital that was best equipped to take care of all our children, as we have a second child with special medical needs. Despite Cincinnati being across the country from us, we decided to move there, and I secured their earliest appointment with the rheumatologist. At Cincinnati, our new rheumatologist noted that he would like to test for the IL-18s and immediately ordered the labs before we could even ask about it. He noted that the IL-18s would take a while to drop, so we should still see that it's elevated. By the time that Miles did have his IL-18s tested, he was already well controlled on anakinra. His labs had been normal. His ferritin was at a healthy 95. ESR was 5. And the CRP was less than 0.3. So but the only thing was that his eosinophils were starting to increase at 13%, 1,200, and the IL-18s did come back at 30,000, which confirmed our suspicions that it would have been much higher while he was on his big flare. Rheumatologists watched the labs, and we almost switched to Alaris because the eosinophils kept on going up, went up to 18% at 1,500, due to research that we saw indicating that the highest eosinophils were associated with more complex SJIA phenotypes and also lung disease. Miles had large, days-long welts at every injection site, and he was developing red patches on his cheeks, which made us worried about the possibility of DRESS. However, he didn't seem to have any other symptoms, so we started Zyrtec to help with the site reaction, and we continued to monitor closely. We measured the IL-18s, and then it was actually at 18,000 only a month after the first measurement, and that really showed us that anakinra was treating the disease both internally and clinically. The eosinophils finally decreased a bit, but then Miles erupted into an explosion of itchy, ratchy patches all over his entire body, severe peeling and cracking, diagnosed as probably eczema. He ended up on topical steroids for the rest of the year, including having to switch to stronger steroids multiple times. But it was the first time that he's ever had severe skin issues. But with his IL-18s continue to decrease on medicated JIA remission, with the anakinra, we actually decided to stay on the course of treatment accompanied by the topical steroids. He also had a pulmonary consultation, and his chest CT did show that it was normal. So his skin issues did resolve earlier this year and has not returned since. He's had another rise in eosinophils earlier this year and a third bout of COVID that resulted in a temporary return of joint pain and stiffness in both ankles for multiple days, as well as a return of the red patches on his cheek. But it subsided as he recovered from the viral infection. Today, he's actually no longer suffering from any skin issues and has continued to achieve medicated remission. His IL-18s are now down to 2,000, as just measured a few weeks ago.